Hi, this is Jonathan Damonti with the next episode of the series, The Problems with Homeopathy. And this one is about the commonest mistakes in homeopathy. It's not the course that I offer, but this is just a background information series. I hope you find it interesting. So let's look at the next slide and see what I'm talking about. So, really, when we think about homeopathy and how we use it, the most important thing we do is make arguments for or against a choice of a remedy. And these arguments need to be listened to because they're definite. If your reliable prescribing is going to stand up to the test, you do need to listen to those arguments that persuade for a remedy and those that argue against it. Don't get hung up on one symptom or a traditional use of a medicine that seems to be correct. So then comes the question, what are useful symptoms? And in homeopathy, we tend to categorize symptoms into spheres. But before we do that, and before we even accept a symptom as being useful, we need to decide, was that symptom a change of state when the patient became ill? So symptoms are the changes from healthy to ill. And if they're not changed from the time of their illness, they might just be characteristic of them in general. So in those spheres that I'm talking about, we're going to talk about thinking and head function, body temperature, thirst and appetite, digestion, urination, menstruation, blood pressure, sleep, and muscles and joints and hairs and other parts of the body. So looking at that in more detail, thinking and memory, has that been affected? Is their alacrity, is their sharpness of memory still good? Do they have any pains in their head? Whereabouts? Do they have other symptoms of their head, such as vertigo? How's their sense of temperature? Not the thermometer temperature, but how they feel. Do they feel chilled and need to be wrapped up in two blankets? Do they need to uncover? How's the weather affecting them? How does clothing and covering up affect those temperature sensations? Thirst or thirstless. What do they want to drink? Appetite or not? What are their cravings and or aversions? Their digestion, the system itself from mouth to stool, and how it's functioning, how it's changed. Their urination and their bladder, if there are any symptoms there, any changes. Do they have a full stream? Are they able to evacuate it fully? Are they having accidents? Is there any change in the quality of the urine? How's their bladder? Is there any pain, pressure, etc.? Menstruation symptoms, again, a lot of variables. The duration, the length of it, the frequency of it. Is it 28 days? Has it changed? The quality of the blood, the pains that accompany the period, before, during, after, etc. So lots of information there. Libido is something that, I'm rarely going to ask directly, but you might hear about in the story of some symptoms. Their pulse, the heart rate, and their blood pressure change. We're looking for that. Quality of their sleep, the waking, the difficulty to fall asleep, the times of waking, what they feel like when they wake up in the morning. And so you address these questions about their sleep under the umbrella of sleep, but you get the details of it. Skin health, how it might have changed, etc. Muscles and joints, location, what makes it hurt, what makes it better, what do they need to do to not feel the symptom itself. Hair and nails could be very useful information. So, very detailed, and you can expand until you're really clear on what is the nature of the symptom, not just, oh, my hair is bad, my hair is falling. Well, when? In the bath, in the bed, when you brush. Those are really important. So, what's the result of ignoring modalities? Now, modalities I need to talk about because, first of all, what is a modality? So, a modality is that factor or effect that makes the ill person or a particular symptom of the ill person better or worse. What circumstances give rise to an increase or a decrease of that symptom? So, very simply, it's what affects the symptoms. What makes them better, what makes them worse, what brings them on, what makes them switch off. All that information is so vital because those modalities, the characteristic of the symptom, is what we'll find in the correct remedy. So, for example, a patient might tell you they're worse from the wet weather after midnight, from cold drinks, or they're better from heat elevating their head and from warm hot drinks. So, very different set of modalities. And that's what the homeopath needs to inquire after, whether you're treating a 5-minute case or a 2-hour chronic case. So where do we find modalities in what spheres? And we inquire after that. The times of the symptoms. Sometimes I might ask, in a 24-hour day, when is that symptom worse? When is it better? The regularity of it. Perhaps it comes on after eating, for example. Movements, very important, because how we move is going to be governed by some of the symptoms. The weather effects we talked about, the effect of emotion. Maybe that was a trigger for the illness, or maybe it's a change in emotion while ill. The temperature we mentioned a lot, and how they position themselves, their perspiration, their menstruation, all of that we've looked at. But these are the general spheres that we find modalities in. An important point about modalities is that there are two types. There are those that affect the person as a whole, and then those that affect an organ or a system particularly. So that's important because in that information is where we find the details. So I'm going to give an example case of a young patient. She's traveling in another country and in university, and she called me in this fall of 2020. Tells me she has COVID. And remember, this is a time when all the university students went back to school and COVID was epidemic. Everyone was getting it, horrible flus and so forth. So, but more than the flu itself was the fear around getting sick. 2020, September 2020. So she's very sick and very anxious about the effects of being sick on her studies and especially fearful of getting sicker. She'd managed overnight and is somewhat improved from sleeping overnight with the benefit of NyQuil, which knocked her out. So I want to talk about her symptoms. And, this was a very quick call. I've worked with her before. She knows the type of questions I'll ask and, knows to answer them very simply and clearly. So I might have asked, so are you hot? Are you cold? And basically she let me know she's got fever, sometimes with intercurrent chills. Her hands and feet, always cold. She has a dry mouth with an increased thirst for cold water. She has a cough with desire for fresh air, and it's worse for breathing in. It's better when she lies down, and it's better when she's stretching out on the floor doing a yoga stretch. So, symptoms. You'll notice that there are some modalities in this list of symptoms. Better breathing in, better lying position, better stretching. Those are all positional and functional, like the breathing. Dry mouth with increased thirst. That's normal, but it's absolutely a complete symptom because it has a modality attached to it. So With that information, the homeopath will do an exercise to analyze these symptoms in order to find remedies that cover those symptoms. It's not possible for a homeopath to remember hundreds of remedies with those symptoms in them, and there could be dozens that cover that symptom picture. So what homeopaths use is something called a repertory. It's a storehouse of symptoms with the remedies that affect those symptoms listed below the symptom. And from that information, we do something called a repertorization, where we can graphically view those remedies that cover the symptoms of the case. And, having good symptoms, true symptoms, absolutely true, not inferred or guessed at. Sure, I could say she's anxious, but who would not be? Is that really a symptom in that time? Yes, but is it something I would use reliably when anxiousness is quite normal? So these were true symptoms of her illness, not the general characteristic of her. So in doing the repertorization, I came up with two very strong candidates. One was Aconitum napellus, which is on the signpost there, and the other was Bryonia alba. Both very good flu remedies, cough remedies, fear remedies, anxiety remedies, thirsty remedies, etc. I did choose one, and it worked well. The one I chose was Aconitum napellus, aconite as it's commonly called. I gave a 30 CH preparation, one dose, and by morning she was a lot better, with the express instructions to repeat the moment she felt worse, and in 2 days she was back in class. So it was a very effective result. Of course, she's young, healthy. It was an ordinary flu in the end. But, remember how much fear these flu cases gave people. It was a crippling amount of fear. So mainly the advice here is about paying attention to modalities, because they will be the leverage in your arguing for a certain remedy. Those modalities are true symptoms that are characteristic of the illness, the state of illness the patient has, and support the choice of remedy. So that was a case, very simple, and but I will say this, I had 100% confidence in aconite helping her. Not because I've used it 500 times for COVID. No, because it fit her state of reaction. I knew it would buoy her immune system. I knew that it would help her resolve the stuck state of inflammation that she was in and allow her immune system to work more effectively. And I think that's true. So that's what we do as homeopaths, is find simple pieces of information to make simple arguments for simple remedies. That case took me 10 minutes, literally, and there's no reason why anyone couldn't learn how to do this. So, not to ramble on, hope you enjoyed it. Sign up to receive more of these podcasts and YouTube videos, and hopefully learn more about homeopathy, and more importantly, learn that homeopathy simplified is really that. It can be a tremendous tool for health.